Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog I shared traveling for long-term ventilated adults on a ventilator with tracheostomy, not a gimmick but a reality. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to share another public endorsement for more home health care instead of hospital care, and in this week I want to share an article from the ABC website, Home Health Care is Cheaper and Safer. In the article, that also features an interview from people who are having dialysis treatment at home instead of in a hospital. The pros and cons of home care are being discussed. However, the bottom line of the discussion is clearly leading towards improved patient and family outcomes and patient and family satisfaction, massive fiscal savings, and the freeing up of beds and other resources in acute hospital settings. The question is, how long can intensive care units afford to waste $5,000 per bed day for long-term ventilated adults and children with tracheostomies to be looked after in intensive care instead of using specialized intensive home care nursing services like ours, Intensive Care at Home? You can read the original article below when you're clicking on the link, or you can check out on the ABC website the original article. Again, I put it below this video. What do you think? Do you think that intensive care units can continue to waste $5,000 per bed day to look after long-term ventilated adults and children with tracheostomies in intensive care, instead of sending them home, giving them a choice by using specialized intensive home care nursing services like our Intensive Care at Home service? Leave your comments on the blog. For more information you can contact me on 041 094 2230, or you can email me at patrick@intensivecareathome.com.au. That's Patrick just with a K at the end. We are also currently hiring enthusiastic and experienced intensive care nurses with critical care certificate for ventilated clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities there as well. Again, for more information you can check out our career section, or you can contact me directly on 041 094 2230, or send me an email to patrick@intensivecareathome.com.au. That's Patrick just with a K at the end. You can also contact me if you're from an intensive care unit and you want to know how we can help your patients in your intensive care unit, or if you have a family member in intensive care where you're thinking about they want to go home and leave intensive care, contact me also. Thank you for tuning into this week's blog. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you next week in another update.